Lindsay asked us today if we could come and talk about how libraries, health libraries, can promote trusted health information. I think lots of you on this call may know PIF already. I'm the director. I'm Sophie Randall, and we're just going to run through some of the work we've been doing recently and just think about how you can get further involved with that. So I'll ask the old next slide, please.
I was just going to say, hopefully you are seeing the slides now.
I am seeing the slides.
Good.
Yeah,
that's okay.
So I think many people on the call probably do know us, but the Patient Information Forum has been established for more than 25 years now, and we provide expert guidance on the production of high quality health information. And we're the UK membership organisation for people working in patient information. And we were actually set up after a working group of people up following a King's Fund report. So the kind of link goes right back to the Health Libraries group. We've evolved a lot over the last 25 years or so, and in 2020 we launched the PIF tick quality mark for health information, which has been a real focus of our work for the last 5 years, and now has almost 160 certified organisations certified as trusted information creators under that scheme. Next slide, please. So PIF's vision is that everyone has access to personalised health information to enable them to make informed decisions about their health, well-being and care. And that vision actually has been, remarkably unchanged for probably the last 10 years. Not much has changed in that vision, but the challenges around it have changed. And I think perhaps one of the most crucial words in that vision is the everyone. It's having that access, there's equitable access to health information that people can use and understand. That's become so important, became so apparent during the pandemic. And now we face new challenges with misinformation, which we will discuss a bit more. So although the vision has stayed the same, the environment in which it operates has really evolved. So next slide, please. So what we're going to do is just have a quick look at what PIF does, the impact of misinformation, which I know a lot of you have been, you've recently done some work on. Knowledge is power, some data that we commissioned from Ipsos last year. Some new work that we've been doing recently on Google AI summaries, and a co-production project that we did with libraries, which some of you on the call were involved with, principally Ruth, who has been on the project all the way through, but I know some of you on the call took part in some of the co-production workshops that we did. So next slide, please. So what do we do? In a nutshell, we promote access to trusted health information for patients, carers, the public and healthcare professionals. We set standards for health information via the PIF tick certification scheme. We set those standards with our membership. It's very much a set of standards that are co-produced with the members. They were for the original pilot. We have an independent steering group that oversees the criteria, and they've been updated twice since launch, most recently really to reflect the new challenges of AI and also the kind of increasing recognition of the need for translated health information. We advocate for the public's right to inclusive and accessible health information and support. And we urge NHS organisations to really integrate that health information on care pathways. Increasingly, we're working to fight misinformation. We also provide a lot of training for members and non-member organisations. So all of that activity is underpinned by 4 strategic pillars, which are the quality of information, the expertise of the people who produce health information, making sure that information is inclusive to everybody and that it is integrated into those journeys. So next slide, please. So we know that health librarians have a crucial role to play. We have worked alongside health libraries since we started, and we continue to do so. We know that you provide access to evidence for use in health information, and that's absolutely crucial, and that the Health Literacy Toolkit and raising awareness of health literacy amongst NHS colleagues is a key part of the role. And increasingly, what we're seeing a role of signposting to high quality health information and really helping people navigate the field of misinformation, and we saw the useful new tools that have been published recently that will really help people do that. So next slide, please.
That's the one with the video that it won't play, I'm afraid.
Yes, so unfortunately, we were going to show you a video from YouTube, but it's been blocked. And this video I'm going to share in the chat now so you can watch it later. But it's a piece of work we commissioned from Ipsos's health ethnography team, where there's about 5 people who are interviewed in the video. One is an Ipsos researcher, one is the head of information, the head of medical at Macmillan. There's an academic who's researched cancer viewers on TikTok, the patient advocate, and just a general member of the public who's struggled with women's health issues, talking about the overall impact that health misinformation has. So please do watch that later on after the presentations. We went on to do this piece of work with Ipsos because last year we commissioned a larger piece of work from Ipsos, which looked at access to health information in the UK. And the work was done using their knowledge panel. And we used their knowledge panel because it ends up with a sample of the UK population that is representative of the UK population. And they have methods to actually make sure that people who are digitally excluded can take part, and they're offered different ways of taking part. We wanted to get a really representative sample of the UK population, which is why we made this investment. So the key findings were that half of adults in the UK are struggling to access trusted health information. So while there's a wealth of health information out there, people simply don't know what to trust. Significantly, 1 in 10 adults in the UK said they had been affected by misinformation, and actually this increased to 1 in 5 for ethnic minorities. So it's quite a wide inequalities issue there, big difference there. And yet 8 in 10 adults in the UK agree that access to trusted health information would help them manage their health. So there's a kind of the desire for people to access health information. They want to self-manage, they want to self-care, but actually they're finding it increasingly hard to navigate the information landscape, although they want the information. So next slide, please. Oh, sorry, could we go back one?
Sorry.
Right, they're very similar slides. So this is the second slide of key findings. Interestingly, 1 in 6 adults in the UK said their views were not taken seriously by their healthcare professionals, and that increased to 1 in 4 for ethnic minorities. Only 1 in 10 adults with long-term conditions in the UK were signposted to patient organisations. And I think, I'm trying to remember the figure off the top of my head, but I think it was 1 in 5 hadn't had people with long-term conditions hadn't had any information since diagnosis, which was really concerning. So 2 in 3 adults say that independent verification of health information would really increase their trust, because what happens when people don't get health information signposted from healthcare professionals or NHS services is they go online and they look online. Haven't got the data on this slide, but it was the first port of call when people go and look online pretty much is the NHS website, and that's used by about 52% of people said they would look at the NHS website. But 49% of people said they would look at Google or another search engine to access health information. And those kind of 2 sites were really key. So national media, so national news, newspapers, social media all scored under 10%. So Google search and other search engines, but we know Google is the main engine used, is a real sort of trusted by people to connect them to health information, and that's been one of the big changes in the landscape since we did this piece of work. So I'm just going to talk a bit about the work we've been doing on Google AI search summaries. So if we could go to the next slide, please. So in June 2024, very soon after we collected the data for this piece, Google launched its AI search summaries, which you've probably all seen at the top of a search box. And actually health is the most impacted sector by search summaries. So there's been two real impacts of this. One is that actually people aren't, particularly if they're looking on smartphones, they're not really going much further than those summaries. They're looking at that information and then they're not going any further. So particularly in the charity sector, but not exclusively the charity sector, it's impacting all sectors. There's been a fall in traffic to health content and to support lines as well, because people aren't getting to the site to get the support line number. So we did some work with our membership. About 70 organisations took part in some roundtable meetings, and we partnered with Marie Curie and Macmillan to produce a kind of search, a sort of summary of member concerns. And I suppose the overall concern is that this zero-click approach will pose a risk to health outcomes. So we have asked members to share their concerns, but importantly, we also asked them to screenshot some of the Google AI search summaries, which were either inaccurate or had hallucinations or referenced US sources which weren't relevant in the UK. We've put all that together and we have submitted that as a kind of dossier to Google with some recommendations. So if we could go to the next slide, please. So the specific concerns raised really looked at the quality and accuracy of content, really the lack of localized source material, because so much of the links in the Google associated with these summaries signpost to the Mayo Clinic or US sources which might not be relevant in the UK. Impacts on health inequality and health literacy. Some of the summaries were quite complex, and also that lack of access to support. And there's one summary of one of the kind of screenshots that was submitted by the Lullaby Trust, which showed an inaccurate AI-generated search summary, which said the charity had collaborated on a baby bed. In fact, the bed is made by a company which the charity believes sells unsafe products. So that, you know, the charity can't understand how that happened, and they think it's just a kind of AI hallucination. The AI will create an answer that it thinks sounds right, but actually this could, that could represent a real child safety risk, but it could also be a reputational risk to the charity. So there are real concerns about the quality of these summaries. And as we know, people are going to Google to look for health information, and now health is the most impacted sector. So we have submitted the report to Google. Sorry, can we go forward, right?
Sorry.
And we've asked them to actually suspend AI summaries on health topics until accuracy and safety issues are resolved. And we want to work with them to agree a framework for the verification of trusted health information. And much of that we really want to focus around PIF, because we know these organisations are certified, they've been through a robust process. And we've used that framework with the YouTube Health Shelf. We want to make sure that they are sending people to links and support at every stage, which is, relevant in the UK. And actually, we would like much clearer, explicit warnings that AI health summaries on health topics may not be accurate and should not be taken as advice. And we also want to, within those searches, make sure there's directions to seek the advice for a healthcare professional. So the kind of update on that now is that 30 organisations in health have now endorsed these recommendations. And we had a meeting with Peter Kyle last week, who's the Secretary of State for Technology, to raise these concerns with him. And he has said he will raise them with Google. He was really concerned about this. So we'll wait to see what happens, but we are meeting with Google again in a month's time to take this forward. So next slide, please. So what can you do to help this? I can pop the link in the chat, but we are asking organisations across health to endorse the recommendations of this piece of work and to help us raise awareness of the limitations of AI summaries. We're going to wait to see what happens with Google, but we will start trying to raise some public awareness that actually these AI summaries on health shouldn't be trusted. But above all, I think it's about helping signpost people where possible, or encouraging health professionals you work with to make sure that they are signposting to credible and trusted sources of information, and that people really are getting the health information when they need it on those journeys through the healthcare system. So next slide, please. So I just wanted to touch on the work that we did with Ruth earlier in the year, where we're trying to work with NHS England to increase signposting to trusted health information, and the kind of health literacy toolkit for public libraries signposts the PIF-TIC website as a source of trusted health information. Now we know that we need to do quite a lot to the TIC site to invest in it now. As we've grown as a small charity running this piece of work, we started the site on a shoestring, and now we really want to invest in it so that it is easier for people in public libraries, but also health libraries, to signpost people or professionals to sources of trusted health information. And we ran 2 co-production workshops, one with public libraries and one with NHS health librarians. And I know that there are some of you on the call today. And now we're taking that work and we're making some updates to the TIC site, which will hopefully go live by the end of September. So most of that is going to sort of focus on making the site much more searchable and really helping connect people with those everyday health topics that people are coming into libraries with. So next slide, please. So the recommendations from that project, which we're working through now, really were to have improved signposting from our PIF website to the PIF-TIC website, which we have implemented. And now we're working on an addition of a search function to really help people find those topics that they want, because sometimes some of the organisations' names don't necessarily let you know what they provide. So, for example, Anthony Nolan, that charity provides a wealth of advice on stem cell transplant. We'll have topic pages with unique web addresses, short descriptions of each of the certified producers. We've implemented this first recommendation of sort of topical information collections, but we're also going to be looking at training videos and promotion materials and accessibility improvements. So that is a work in progress. So you'll have to bear with us on the website over the summer while that work takes place. So next slide, please. So this was the first collection of resources that we did as a result of this co-production workshop. So through May, we had women's health resources on the TIC site. There are about 8 different resources from different charities covering topics from menopause, cancer screening, baby loss, migraine, to lots of kind of very common issues that people might come up against. But also importantly, they were in lots of different formats that the information was provided. So it's also health literacy, very different styles of resources that would meet the needs of different people. And that collection can still be accessed on the website. We also had some recommendations for after that activity, we had some recommendations for NHS England. So clearer linking and endorsement of the PIF-TIC website from the NHS website and app to simplify user journeys and increase trust in that overall NHS brand. And the opportunities for NHS libraries increasing the awareness of PIF-TIC, particularly amongst healthcare professionals that they work with, as well as the public. So next slide, please. So really, that is where we're up to at the moment with these particular pieces of activity. But we really would like to hear from you about how we can improve the working relationship, how we can support people. I know a lot of you are PIF members, but to make sure that you're accessing all the guidance on our website and our webinar programs. So if you haven't seen that, then please do go and have a look.
Thank you so much, Sophie. That is super interesting. I got distracted looking at the women's health resources there. So.
Yeah, we're preparing for the next one, because actually what happened, I think we had, I think it was 180% increase in traffic, or 1,080%, I can't remember, Sheila, 180% increase in traffic the week that collection went live. So there's a real need for that. So really happy with that. And I think there's just lots of I think the PIF-TIC has got to a critical mass now of organisations and content. So the next one will be on mental health and wellbeing, and that will go live in August.
Yeah, thank you. Does anyone have any questions for Sophie? Just seen a comment in the chat about the Google AI summaries. I've been following that work as well. I just find it so scary, actually, and really important that it's something that you're calling out and working on. So
I think there is one hand up I can see.
Yeah.
Imrana, sorry.
Yeah.
Hi there, Sophie. Excellent presentation, thank you. And I look forward to seeing you at ICML in 2026 as well. So a question is, with the elective reform plan that the NHS published, and it talks about patient engagement portals, and that GPs will be given £20 per advice and guidance session. Are you engaging with that at all in any way?
We're not at the moment. We have done quite a lot of work around patient portals separately. So we did a piece of work last year, which was published, I guess. When did it get published? Probably kind of towards the end of last year, which we worked with. It was funded by the Health Foundation, and we worked with the Professional Record Standards body that sets standards for the way that health records are recorded. And what we found was a lot of portals are really not designed with users at their heart.
True.
And that actually one of the challenges is that people are having to use multiple portals to manage different aspects of their health, particularly if they've got multiple conditions. And the portals don't talk to each other, and people are left as the integrators of their care. But because that's for people who are using them, but there are a lot of portals which people use once and never return to. So it's really, I think that the user engagement element around portals and making sure that they meet people's needs is really, really, really important, and that they are health literacy friendly, because it's that they need to be easy to use, they need to be accessible, but once you get into them, quite often the content isn't that accessible as well. So it's making sure all of that is in place, and actually it's really important that these things start to talk to each other as well in a way that makes sense for people.
That's useful. I think some of us are engaging with our primary care networks, and possibly may have the potential to influence things, and if we're linked in with the patient engagement portals, etc., and then we can refer to you guys, etc. And I think it may be a good idea to set up a community of practice to see where people are actually engaging or have the inroads to engage with patient engagement portals, to see how we can influence them in terms of health literacy and health information.
Yeah, I think it's really important. We did a piece of work in maternity in Sussex last year as well, where it was actually, we were developing, co-producing some materials for women who had recently arrived in the UK, and women with worse perinatal outcomes and worse maternal outcomes. And what we found there was that maternity had gone 100% online booking and 100% digital health records, but lots of the women actually couldn't engage with that portal. And actually, it's really difficult for them to access maternity care, and there were kind of multiple reasons for that. But they were all there were layers of digital exclusion. There were language issues. There may have been a phone but no data. But very often, although a kind of a digital inclusion assessment had been done, what we found was that very often there would be one phone in a family, and it would be with the husband. And then that meant that, if the husband wasn't there, or, the woman wouldn't have access to their records, or sometimes, the other end of the scale, there's the potential for sort of coercive control there as well, if you don't have access to your own record. So there were some quite complex issues. We produced some really simple, co-produced with the group, some really simple, easy read resources and YouTube videos that could be shared via WhatsApp and stuff, which is what the women wanted, and those were translated into five Finance 5 resources translated into 6 languages. So I think we have to be really careful when we're designing portals to make sure that actually we are really making sure that we're designing with people, and that when we are looking at the digital exclusion, we do it in a really thorough way.
Yeah, absolutely. And are you linking in with the Digital Poverty Alliance?
We have worked a lot with the Good Things Foundation, but not with the Digital Poverty Alliance, but that's something we perhaps should have a look at. But yeah, I'd be really interested to talk more about this, because I think with the push to, and when we did our submission to the sort of NHS plan, you know, we did make the point that actually, yes, digital can be really powerful, but it can also really exclude a whole group of people, and we need to make sure that those people are provided for.
Great, thanks, Sophie.
Sorry, Ruth.
Thank you, Sophie. It's always really interesting, really clear presentation in terms of the work. I'm conscious that different people on the call have different levels of awareness in terms of the PIF tick itself.
Yeah.
And I wondered whether you could just very briefly outline what the process is for the PIF tick, just in case people aren't familiar
absolutely.
with it, what it involves.
So we have 10 criteria for the PIF tick, which organisations must meet if they wish to become PIF tick accredited. And those range from having a kind of written information production process, to having trained staff, to having evidence-based information, to having clear risk communication, to involve users, to make sure your information is inclusive, to make sure that you're measuring, measuring impact and, you know, gathering feedback. So it's kind of really thorough set of criteria. Against each of those criteria, there is a kind of a standard everybody must meet and a desirable, because what we see with the tick is that we want to push people through and we want to encourage this cycle of improvement. So what people will do, they will apply for the tick and they will have to submit all of that evidence into our assessment portal, and then they will be allocated an assessor who will go through their evidence and give them an action plan. When they get to the acceptable level, they will then be awarded the tick, and then that process is repeated annually. So we assess their information production process, and anything that they have used, they create using that certified process, whether that's a book, whether it's a leaflet, whether it's a video, whether it's social media post, can have the logo on it, PIF tick logo. And that certification is repeated annually. Once people have got really mature with the PIF tick after a couple of years, we also do information assessments. So we will take a piece, we'll ask them randomly to, you know, we'll pick a couple of pieces of information and we will look at the jobs and the information to make sure that what they say they do, they are doing. Because I think without that, it's, you know, it's great to have the process, but we also want the certainty of making sure the process is being used. So that is, yes, certification rather than an accreditation scheme. It's not a self-assessment. People have a separate assessor. Does that answer the question, Ruth?
Yes, I think it does. I think it demonstrates that actually what you've done with the patient information form is actually build on what was the information standard that people may remember, because one of the criticisms of the standard was that there wasn't enough about involvement in terms of looking at diverse needs, and that there wasn't enough about spot checking. Yeah,
I mean, I think one of the things, it's really interesting for me because we've looked at stuff as it comes through, and I think the interesting thing for me being on the judging panel for the last BMA Patient Information Awards was it was really noticeable how those things had changed the health information that was in front of us. It was written in much plainer language. It was more concise. It was just easier for people to access and navigate. And when in the submissions, you could see that people had really thought about how they were going to measure the impact of what they were doing. And now we ask people to do that because we think it's important that people know that they're making a difference, but also because then that leads to improvement. But actually what it did show was it helped people write their entries for the BMA Awards as well, because they were collecting the data. But that was really, that for me was I suppose for me in a kind of terms of kind of personal satisfaction, it was saying actually you can really see the difference between the organisations that are PIF tick certified and they aren't in terms of their health literacy friendliness, if you like, of the resources. And we do recommend people aim for 9 to 11 as the kind of minimum, as their kind of reading age on resources. And, you know, we know that for a lot of people that can still be inaccessible. So we encourage people to provide easy reads or other alternative formats as well.
Thank you, Sophie. We've got about 5 minutes left. I just want to check, did anyone else have any questions for Sophie? There was a question about the Google Analytics, the Google AI works. I'm sorry. Yeah. I've popped the link in the chat, but are we okay to share these slides as well, Sophie?
Yeah, absolutely. Yeah, absolutely. And I will make sure that link is available for you, for people. It's difficult, I know, for NHS organisations to endorse, and you know, in charities it's easy, you know, they can decide, but I can make sure the link gets shared as well with you, Lindsay, so people, if they wanted to have a look at that, can.
Perfect, thank you.
Yeah, but we will keep you updated with where that goes, because for us that's a real threat at the moment. Okay, brilliant.
Okay, well, thank you again for a brilliant presentation, and thank you everyone for coming along to both this and to the AGM. If we'll circulate the slides, and we have recorded this session, so that will be on our YouTube channel as well. So if you want to catch up, you'll be able to find it there. Thank you very much for coming.
Thank you for having me. It's always a pleasure.